What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, May 17th, 2024. If this is your first time coming to my channel to see one of my pandemic updates, welcome to my channel. This is where we do the daily pandemic update on all things COVID, any other virus that could be a health threat to you, and we do talk about climate as well, because climate can affect our health too. Hotter summers, which we've been having, can lead to heat-related illnesses. Want to know what's going on with COVID, measles, anything else? We're going to talk about several different viruses today. H5N1, there's been a lot of news on that lately. Subscribe down below. I do these videos every day to help keep you informed and safe because, well, guess what? The media, you hardly ever hear about it. And if you hear anything about COVID or any of these viruses, they get a quick 20 to 30 second time frame. That's all. That's all the airtime they get. Here, we spend anywhere from 15 to 20 minutes talking about this daily. Today will probably be somewhere around 15 minutes. So if you're new, subscribe to my channel down below. Give this a thumbs up if you like the content. The more people that hit that thumbs up button, the more my channel grows. The more it grows, the more people we keep informed and safe. And of course, leave a comment down below if you have anything to say on anything you see today, and share these videos with anyone you know. We have just a few news stories today. Then we're going to take a look at some of our daily data, pollen levels, air quality levels, EMS calls. We're going to take a look at some wastewater data. We may do a couple wastewater sites. We got some CDC data today. Not as much as we normally would on Friday. I'll explain as we get closer. And we're going to see some data from Los Angeles, New Jersey, New York State, and some flu data in between. So we got quite a few things to go over. First off, we're going over to my website. If you've never heard of my website or been to my website, it's a forum website, datareport.info, where I archive stuff on health-related topics, a lot of COVID stuff, and other viruses. We also have COVID outbreak archive, and a COVID positive archive. We have an archive of studies as well, but today we have to take a look at the COVID positive archive because there has been an update to one of the people who have tested positive. Federal Reserve Chairman Jerome Powell. Now, he had a case of COVID back on Wednesday, January 18th of 2023. At the time, he was 69 years old. Well, today there was an announcement. On Friday, May 17, 2024, it was announced that Federal Reserve Chairman Jerome Powell has tested positive for COVID once again and has symptoms. Now, thank you to the person who sent me a message on X saying, hey, Jerome Powell has tested positive. Thank you a lot, because I didn't know about this, and now I found out. I've added it to the website, but we do have to look at the story from Reuters. Why? Because there's something interesting. If you notice, I put has symptoms, and also I should add on there, he is also now 71 years old. Anyhow, let's read what I have highlighted here. Chair Powell tested positive for COVID-19 late yesterday and is experiencing symptoms. Wait a second. Experiencing symptoms? Now, why am I pausing for that? Usually we hear the word mild symptoms. We're not hearing him say mild symptoms. He is experiencing it. Maybe they forgot to add the infamous mild symptoms, or maybe his symptoms are a little more significant. After all, there are studies that show the more times you get COVID, the more likely you are to have the more severe disease or more symptoms each time. It does happen. Continuing on, he is working from home and staying away from others, the statement said, as per guidance from the U.S. Centers for Disease Control and Prevention. So I am glad that he is at least, virtually working from home. That is a good thing. All right, moving on now. A young child in Ontario, Canada, has died of measles. We have not heard about any measles deaths yet, but now we are, and this is relatively concerning. So far, it's only been one death, but as we know, Canada, Ontario, United States, all around the world, there have been an increase in measles cases, and in this case, let's read. It's the first measles death in the province in over a decade, Public Health Ontario reports. The unvaccinated child was under age 5 and was among 5 children hospitalized with infection. So yes, again, please make sure you get your child vaccinated for measles. It is very important that you do that. Moving on to this, just going to read a headline here. This will eventually make it to my website. It has not done so yet. Study: kids with long COVID have impaired exercise capacity. Again, another reason to keep your child safe from COVID. If your child tests positive for COVID, they could go on to develop long COVID. And in this study, they compared 61 children with long COVID and 29 healthy control ages of 12 to 15. The authors defined long COVID as one or more unexplained symptoms for at least 8 weeks after initial infection that negatively impacted daily life. So what they did here was they looked at kids that were still sick 8 weeks after infection, and they found that a lot of kids were still dealing with health issues, and 90% of long COVID patients had health issues. Wow, that is just a remarkable number. More of the reasons why your kids, take a look at this. Take a look at this. I'm going to show this to you. Yes, your kids even need to continue to mask. You're probably going, oh, come on, the masks don't work. No, if masks are worn correctly, if masks are kept on, not taken off to take a sip of water or a bite of something to eat, they do actually work. So please, continue masking, not just kids, all ages. You need to continue to mask in the grocery store. You need to continue to mask everywhere you go. I know there's some states like North Carolina, that's the first one, that's trying to ban it. It's not officially in law as of yet, but it could be soon. I'm sorry. Masks are a health safety protocol that do work, and we need to continue to use them because things like this will keep popping up. We're going to keep finding out new things that this virus can do, and it's going to happen to more and more people. As you know, we're starting to enter into a little bump in the road with COVID, where it's trying to do a little rise again, and you'll see that in CDC data shortly. Guess what? The more times that happens, the more people that are going to go on to have issues with long COVID. And do you want your child to have exercise capacity issues? Do you want them to not be able to make the baseball team? Do you want them to make the wrestling team? Well, if they catch COVID, there's the possibility they may not have the exercise ability to do that. All right, moving on now. We have to talk about Los Angeles because there has been a new update from Los Angeles. COVID-19 weekly update. Data reported May 16th, 2024. Daily average cases 67. Daily average deaths 0.6. Daily average COVID positive hospitalizations. It's still around 102 in Los Angeles. Taking a look now at what is going on with the national allergy map. And we can see here 33% of the country is in medium status. There is a lot of red in the northeast states today, which represents high levels of COVID. And we can also see here in portions of the plains, there are also high levels of COVID, and moderate levels continue generally across a good portion of the northwest and the northern portion of the Rockies. The south is not doing too bad today. Taking a look at air quality levels, and I am going to refresh this so it comes up. It refreshes every 2 to 3 minutes, and when it does, it automatically goes gray. But if we refresh it, here we go. First off, let's start off with the West Coast today. Los Angeles, seeing a lot of orange and red there. That's not good. You may want to consider wearing a mask outdoors because of the air qualities. Make sure you have your HEPA air purifiers running. I have mine off right now because we are recording. Plus, I am going to be getting new filters coming in the mail tomorrow. Yes, it is time for me to get filters. Make sure you always check and clean the filters on your HEPA air purifiers. Taking a look here, what's going on in Louisiana, we can see here, there are some pretty high air quality levels at this time, which is not good. Down in New Orleans, we're seeing hundreds, well over 100. And Houston, you're still seeing some air quality levels that are in the moderate range. And of course, we still have a whole slew of areas that are in the yellow, anywhere from Georgia, Alabama, Florida, Indiana, portions of the Great Lakes, portions of Pennsylvania. New England's not too bad. We're starting to get some lighter yellowish green colors. That's not terrible. We can tolerate that. But again, like North Carolina, yeah, there's just a lot of moderate to near moderate levels today. So that's something that you have to take note of. Severe weather today. We do have to talk about this because this can threaten your health as well. A point in case, there was a bad episode of severe weather yesterday in portions of Texas and Louisiana. I believe the latest count I heard was 4 people have died from severe thunderstorms. There was significant wind which blew out glass on windows on tall buildings in Houston, Texas, and then there was some significant damage in Louisiana as well. I mean, wind gusted near 90 miles per hour in some cases. Large hail. I mean, hey, climate. It can affect your life as well. Today there are threats of severe weather across portions of extreme northern Florida, southern Georgia, southern Alabama, southern portions of Mississippi, and once again New Orleans, and then the northern plains as well. And within this, there could be the isolated threat of tornadoes today. Please heed all weather warnings and take them seriously. Alrighty, I do have another place where I talk about climate. That is on Twitter at Climate Data Report. If you want to follow that account, the handle is at Climate Data, then capital R, lowercase pt, Climate Data RPT. Alright, moving on, we do have to talk about this now. EMS incidents. They have been hovering slightly lower this week in Philadelphia. 770 EMS incidents reported. Live looking at Montgomery County shows there are currently 12 incidents. Most recent 2 are respiratory emergency, and there is a stroke in there in Lansdale, Pennsylvania. And taking a look at Chester County, Pennsylvania, these are suburbs of Philadelphia, you know, counties just outside of the major city. And there's a few calls in Chester County. Respiratory difficulty, heart problems, falls, overdose, heart problems once again. Walgreens this week, national positivity rate was 15.3%. That's a difference of up 1.4%. Testing was down slightly this week. All right, we have to talk about wastewater briefly. I thought maybe we would look at a wastewater site or two. I don't know. We'll see here. Taking a look, there are still 3 sites that are on the CDC page that are still in the red at 80 to 100%. We'll talk about those sites on Sunday when we do our full wastewater update. I haven't really gone through all of the sites yet. I just refreshed the page. But one thing we also do see here is the number of 0 to 19%. That's really low levels of COVID. That actually dropped by 3%. And here's the other bad thing. The number of these orange sites, 60 to 79% COVID detected, that actually went up by 14%. So there's a little bit of a shifting going on here. The tide is starting to change. We got a new variant, KP.2, the flirt variant. It's out there, and it is starting to cause a little bit of an increase in some areas. And there's also a change to this map as well, which takes a collaboration of all the wastewater sites in a state and comes up with a level. We're starting to see some moderate places, but we're also seeing a very high state. Hawaii is now coming in very high, moderate in Nevada, moderate in Minnesota, and take a look at Delaware here. Delaware is now coming in moderate as well. Again, there's just one wastewater site reported there. So if that one site comes in at moderate levels, the whole state represents a moderate level. But with Minnesota, it's 33 sites. With Nevada, it's also, once again, just one site. And Hawaii does have 7 sites reporting. So over the course of 7 sites, it equals to a very high level. So that is not good to see. Everywhere else that I'm looking at here is either low, minimal, or just simply no data at all, or not reporting. All right, moving on now. Let's take a look at one wastewater scan site. Let's just randomly go somewhere. How about we come down to Arkansas? We have checked this site many times because Harrison, Arkansas has had issues with norovirus. Let's do an update check on that. And Harrison, Arkansas for COVID is low at this time, not seeing an increase. RSV is low. Influenza A is not rising. That's a good thing. Influenza B is low. HMPV has dropped. And take a look at this. Remember, they had that big rise for norovirus back in end of March. Actually, no, early April through mid-April. Well, they have since dropped. They then tried to go up again, but now they are dropping once again. No issues with Mpox and hepatitis, just a few detections back in April. All right, moving on now, taking a look at some CDC data, hospital capacity data. Now, this is from May 11th. I want to refresh this. Something tells me this is behind. We'll check, though, because there's a lot of CDC data that is not updated. And let's take a look here. Okay, we can see here now, it's still from May 11th. On May 11th, the percent of inpatient bed capacity that was occupancy that was being used was at 74.2%, and for the ICU, that level was at 68%. So 68% of all ICU beds were being used in the United States. All right, moving on now. Yes, here we go. This is where we have some bad news. Now, this says data from May 11th, posted May 17th. Again, this is the same number from last week. This is for hospital admissions. That I went back to my video from last Friday. That is the exact same number I told you about last Friday. So, yes, that obviously is not a good thing to see that not update. However, this does look slightly different here, and you can see here that it looks like the number of emergency visits for NUP data through May 11th. Okay, but I can show you here there are substantial and moderate increases at that time in several states like Nebraska, Wyoming, Utah, Colorado, New Mexico, California, Hawaii, which makes sense. We just saw the wastewater for Hawaii. It was very high. And then you come up here to New Hampshire. That's high as well. All right, moving over to this now. COVID. It is growing or likely growing in several states now. It is definitely growing now. This is the growing state. In Florida. If you're in Florida, your epidemic status for COVID-19, it's on the rise big time. Taking a look at Georgia, you're likely growing. Texas is likely growing. Arizona, likely growing. Nevada, likely growing. California, likely growing. Oregon, likely growing. Washington, likely growing. Minnesota, likely growing. New Jersey, likely growing. Alaska, likely growing. Hawaii, likely growing. And not a state, but a district. District of Columbia, Washington, D.C., it is likely growing at this time. So we are definitely starting to see it grow in some places. It's still stable or uncertain in many places. It's still likely declining and declining in several states as well. Moving on now to the CDC variant page. This updates every other week, so we did not get an update next week. We'll get one next week. And the latest estimate for KP.2 is at 28.2%. JN.1, which caused the winter surge, is at 15.7%. Taking a look now at this week's influenza map, and you can see here, I don't believe this includes influenza A, which is why we were seeing so many places come up as minimal or low at this time. So if some places are seeing an influenza A rise, I don't think this map represents it very well. If you know otherwise and I'm wrong about that, please let me know down below. I want to know, does this include influenza A? Pretty sure someone told me it does not. Taking a look at wastewater for influenza A, we can see here a lot of green, which is minimal, low, even moderate. There's some of these brighter greens, which is moderate, but then we start getting into these purple colors, and those are some places that have some higher levels, and Texas is a state with that. Even northwest New York, Oswego County, there's starting to be a higher detection. California has a few higher detections. And then we have this like purplish maroon color. It's coming in as high in Kansas, so that's not good. And then up here, South Dakota, there's a higher wastewater site, and yeah, not seeing any others. Actually, we can zoom in here. I think there is one up in Maine. Pretty sure we can zoom in on this. Yes, in Cumberland County, Maine, there is one that is in the moderate category. So, again, moderate to high. It's starting to show up in a few places. Not in a lot of places just yet. And as far as we know, this is coming from animals, not human, cattle, at this time. Alrighty, moving on to New Jersey today. 161 hospitalizations, 67 out of 70 hospitals reporting, 5 people on a ventilator, discharges 29 at this time, and 17 people in the ICU. We'll have to see if we get an update from New Jersey over the weekend. I'm not certain we will or not, and if we don't, there is also something I want to show you from New Jersey. I'll save that for the weekend when we have less things to report on. Now moving over to New York State, where week over week we're continuing to see a slight rise in cases. Slightly down from yesterday, but higher than last week. 726 new cases have been added, and hospitalizations are starting to reflect from that. There is an increase in hospitalizations. 460 people in the hospital, 45 people in the ICU. I wouldn't be surprised if by the end of May they get back to around or near 500 hospitalizations once again. It's not a good thing, but it's to be expected. There's a new variant. The wild card is how long does this increase last? Alrighty, folks, that does it for the Friday edition of the Pandemic Update. I know, it went a little longer than expected, but there were quite a few things I had to talk about. We will have another edition of the Pandemic Update again tomorrow. If you enjoyed us, give it a thumbs up. The more people that hit the thumbs up button down below, the more YouTube pushes this content out. If you have any comments on anything that you saw today, maybe it's something I'm not reporting on that you would like to see, or anything, leave that down below. Share these videos with anyone you know, and of course, subscribe. If you're new to the channel and you're saying, wow, someone who's still reporting on COVID. I mean, I hear nothing about it on the media. Well, just subscribe down below. You'll hear about it here every single day. Thanks for watching, and I will see you all again tomorrow. If not, have a great weekend for those who do not catch my weekend updates. Thanks for watching. Take care.